A chain of events resulting in the Miami Jewish health systems began in the Midwest during World War I, when a Jewish merchant rescued a Lutheran, Adam Rice, from a mob attack fueled by anti-German hysteria. Adam Rice moved to Miami, and when he died in 1939, as a grand gesture of thanks, he left $10,000 for Ida Cohen to establish a home for Miami's elderly, widowed Jews. In 1940, the home was incorporated, and Ida Cohen became its first president. 5 years later, the home opened in a small house with 23 beds. In 1954, the Douglas Gardens campus opened, marking the beginning of decades of rapid growth. And in the 1960s and 70s, the home achieved national recognition and became a leader in geriatric long-term skilled nursing care. The 1980s and 90s marked a new era as Miami Jewish transformed from a nursing home and hospital to a full continuing care campus.
But we have over 1,200 employees between Miami Jewish Health Systems and our partner agencies that work with us. And I can't be more proud of the type of care and service that's provided on this campus.
One of the most common questions people ask me is whether I get depressed working with older people. I tell everyone who asks me that it's actually quite the opposite. When you meet someone who's lived 80, 90, or 100 or more years, you hear about how they've dealt with adversity, how they've been able to be resilient, how they've been able to bring change, even later in life. It fills you with a sense of hope.
Well, when my kids had lost their father, the first thing they said was, "Mom, we're going to pack you up and you'll come live with us." I says, "Are you crazy? I would never live with you. I want my independence." He was happy here. He loved to walk, and he walked over these 27 acres or so every day.
He was on Alzheimer's floor, and I stayed with him for 2 years. I never went home. I chose to do it. And my children were against it, and they were my children. I was his wife.
We make decisions, and I decided everybody dies. I don't want to live dying. I want to die living. And the place I can do that is in a place like Miami Jewish.
By doing what I do here, I honor my mother and father, I honor your mother and father, and I honor everybody's mother and father.
Today, Alzheimer's disease affects over 5 million Americans, and the numbers are growing. We're facing an epidemic. Now, when many people come to me in our clinic, they're hopeless. They feel that this is an incurable disease that there's really nothing they can do about. If someone comes in here and they're lonely, or they're isolated, or they don't have any more hope, I know that we already have cures for that. We can help someone make connections with other people. We can give them hope. We can give them a dignified and meaningful experience.
Dr. Agronin is one of the most amazing people I've ever met.
Like they say in Spanish, punto y aparte. He is one of a kind.
I really think his research is going to go far, and he's going to be a major force in the Alzheimer's field and finding a cure.
Our connection with Miami Jewish is for my wife, Janet, who was diagnosed with dementia a couple of years ago. We've had a wonderful experience. They have put her into this memory program at the Gersh Institute, where she attends twice a week, and that's been an absolute godsend.
When you walk this campus and you look around, it gives you a sense of pride to see how far we have come.
If you go back to Ida Cohen and the folks that were involved 75 years ago in setting this up as a nursing home for widows of Jews at that point in time for 23 people, I doubt they could have envisioned what it has developed to today. So what will it be 75 years from now?
I think we
we'll remain the champion that we are, proud and strong.